Madam President, if you had to pick a country anywhere in the world where you faced a serious illness, you're likely to pick the United States. Here we have some of the greatest hospitals, doctors, some of the greatest research institutions in the world. In some other countries, they certainly have good medical care, but if you could only pick one, I certainly would pick this country, the United States of America. And that's why it's kind of surprising to learn that when it comes to some basic indicators of how well we're doing in the United States compared to other countries, there are some surprising answers. We're facing a public health crisis in this country today that is often overlooked and ignored. And it is one that I'm sure would touch each and every one of us. It's the issue of maternal and infant health. Too often in our country, new mothers and their babies, especially women and babies of color, are dying from completely preventable health complications. Take this statistic to heart. The United States is only one of 13 countries in the world where the death rate of new mothers is worse today than it was 25 years ago. How can that be possible? In the United States of America, mothers are dying at a rate worse than it was 25 years ago. Nationwide, more than 700 women die every year as a result of pregnancy. More than 70,000 others experience severe, near-fatal complications. In my state of Illinois, 73 women die every year due to pregnancy-related complications. And 70% of those deaths are preventable. Not only are we losing these new moms, we're losing their babies. Every year, more than 23,000 infants die in the United States, largely due to factors that could be prevented. Some of them are birth defects, which could be detected in utero, preterm birth, low birth weight, maternal complications. Here is a startling statistic. The United States of America, our home, this great nation of plenty, ranks 32nd out of 35 wealthy nations when it comes to infant mortality. Is it possible? And if so, what are we going to do about it? The tragedy of maternal and infant mortality is even more pronounced when you look at mothers and babies of color. Black infants in America are twice as likely to die as white infants. That racial disparity is greater today than it was in the year 1850. Nationwide, women of color, 3 to 4 times more likely than white women to die as a result of their pregnancy. In Illinois, African American women 6 times more likely than white women to die of pregnancy-related complications. Something has to be done. That's why this week I joined with Congresswoman Robin Kelly, Senator Duckworth, and others introducing what we call the MAMA Act. First and foremost, our bill would expand the length of time that a new mom can keep her Medicaid health coverage. More than half of the babies born in my state of Illinois are to mothers who are covered by Medicaid, health insurance for those who are not wealthy and don't have access to private health insurance. The Medicaid program covers more than half of the babies and mothers as they go through the birthing process. But you know what happens to Medicaid under the current law? 2 months after the baby's born, the mother's cut off. Our bill would expand that to a year. Given that 60% of maternal deaths occur in the weeks and months after delivery, it's imperative that these new moms have the protection of Medicaid longer than 60 days. We understand that many states' Medicaid programs, including my own, are strapped for cash. Our bill will pay for itself by increasing federal tobacco taxes. That's right, the senator just called for an increase in taxes. You bet I did. Because the last time we dramatically increased the federal tobacco tax, it was to create the Children's Health Insurance Program. Is it worth it? that kids would be born healthy and live to their full term in life? Of course. Given that big tobacco and their vaping interest have made billions of dollars at the expense of children and, I might add, the African American community, we believe that they should help pay for this undertaking. As I said in 2009, that's exactly what we did to create the Children's Health Insurance Program. Next, the MAMA Act would improve access to doulas. Too often, black women are not listened to or taken seriously by healthcare providers. Doulas can help provide education, advocacy, and support for women whose voices are often ignored. To this point, our bill would also improve implicit bias and cultural competency training among healthcare providers. Sadly, the United States is still struggling with racial bias in healthcare. Finally, our bill would improve hospital coordination and reporting on maternal health outcomes and ensure widespread adoption and implementation of services to improve care. If you listen to the speech so far, you're probably thinking, there's one thing you didn't mention. Many of those African American women are in poverty, low-income women. That probably explains why they don't have adequate care during their pregnancy and adequate care for the new children. That's what I concluded. It's wrong. The statistics I've given you about racial disparity do not link up with economic status. Even African American mothers, high income, high education, are facing the same threats of maternal mortality. It is not driven by income or poverty. There's something more to the story. And don't we owe it to ourselves to look at it? There are issues which divide this chamber. And one of the issues, of course, is abortion. People with differing views on both sides of the aisle. It's always a contentious debate. But can't we all agree, pro-choice and pro-life, that we ought to focus on this, that we ought to focus on the mothers who are delivering babies to make sure that that mom survives and that baby survives? That's what this act is all about, the MAMA Act. 23,000 infants and 700 new moms die each year in the United States. Some of the worst statistics in the world. We can prevent them with screenings, interventions, and the right health care. I can think of no better way to help babies and mamas on a bipartisan basis to keep them alive and healthy, and that's what the MAMA Act would do.